Idiopathic pulmonary fibrosis can be broken down into idiopathic, which means a disease without a known cause or mechanism, pulmonary, which refers to the lungs, and fibrosis, which refers to excess collagen in connective tissue or interstitial tissue between cells, usually after tissue damage. So, idiopathic pulmonary fibrosis is the ongoing repair process of having excess collagen or scar tissue in the interstitial tissue of the lung. What triggers the repair process is unknown, but it's a chronic process that leads to a progressive loss of lung tissue. Normally, gas exchange happens between the alveoli, which carry air, and capillaries, which carry blood. The alveoli are lined by type 1 and type 2 alveolar epithelial cells, also called type 1 and type 2 pneumocytes. Type 1 pneumocytes make up the majority of the cells. They're simple squamous cells that form a nearly continuous barrier between the air and underlying connective tissue. Type 2 pneumocytes are studded throughout the type 1, and they're shaped like cubes, have microvilli to sweep away invading particles, and secrete surfactant, which is an oily mixture of proteins, phospholipids, and neutrolipids which prevent the alveoli from collapsing during exhalation. Type 2 pneumocytes also have the ability to divide and make more type 2 pneumocytes, and can also divide and become type 1 pneumocytes as well. Now, between the type 1 and type 2 pneumocytes and the capillaries is interstitial tissue of the lung, which has macrophages and fibroblasts. When the alveolar lining is damaged, type 1 pneumocytes release transforming growth factor beta 1, which gets the type 2 pneumocytes to stimulate fibroblasts to proliferate and develop into myofibroblasts, which are fibroblasts with some smooth muscle cell properties. The myofibroblasts secrete reticular fibers, a type of collagen which provides structural strength, as well as elastic fibers, which provide the rubber band-like elasticity of the lungs. The myofibroblasts then undergo apoptosis, or programmed cell death. The tissue injury that triggers idiopathic pulmonary fibrosis is unknown, but there are some known risk factors including old age, being male, and tobacco smoking. Once the process is triggered, however that happens, the fundamental problem is that the type 2 pneumocytes overproliferate during the repair process, and this leads to too many myofibroblasts and too much collagen. To make matters worse, the myofibroblasts don't undergo apoptosis normally, and instead continue to make even more collagen. As the collagen accumulates, it thickens the interstitial layer between the alveoli and the capillary, and that leads to problems with ventilation, which is carbon dioxide leaving the body, as well as oxygenation, oxygen getting into the body. The excess collagen also causes the lungs to become stiff, which makes it hard for air to flow in and out. This restricted lung expansion from changes to the interstitium means idiopathic pulmonary fibrosis is characterized as restrictive lung disease, and a particular type called interstitial lung disease. It causes a decrease in total lung capacity, or the maximum amount of air the lungs can hold. Also, it causes a decrease in the forced vital capacity, or amount of air that can be expelled with maximal effort after a deep breath. And finally, a decrease in the forced expiratory volume in 1 second, which is the air exhaled with maximum effort in the first second. The excess collagen also leads to the loss of alveoli, creating fluid-filled spaces, or cysts, surrounded by thick walls in a pattern called honeycombing. Idiopathic pulmonary fibrosis is a progressive process, so the symptoms generally worsen over time. Problems with oxygenation and ventilation can cause coughing and shortness of breath, as well as cyanosis, which is where the skin turns blue, and digital clubbing, or rounding of the nail beds. Over time, it can lead to significant respiratory failure as the lungs lose more and more healthy functional tissue. Diagnosis of idiopathic pulmonary fibrosis can be done using chest imaging. For example, a chest CT scan can reveal honeycomb appearance and thickening of the interstitial walls. In addition, a pulmonary function test called spirometry can reveal a decrease in total lung capacity, forced vital capacity, and forced expiratory volume in 1 second, which are all characteristic of restrictive lung diseases. Treatment options for idiopathic pulmonary fibrosis include supplemental oxygen, And although there are some antifibrotic medications, they generally slow the progression of the disease rather than stopping it. Unfortunately, the only definitive treatment currently available for severe situations is a lung transplant. Alright, as a quick recap. Idiopathic pulmonary fibrosis is a restrictive interstitial lung disease from increased scarring in the interstitium of the alveoli from an unknown cause of alveolar epithelial cell damage. Symptoms, particularly dry cough and shortness of breath, are progressive, and the condition is fatal with few effective treatment options other than a lung transplant. Thanks for watching. If you're interested in a deeper dive on this topic, take a look at osmosis.org, where we have flashcards, questions, and other awesome tools to help you learn medicine. Otherwise, you can always support us by donating on Patreon, subscribing to our channel, or following us on social media.